bacteria occurred in 1976 in Philadelphia, and there was a convention of American Legionnaires, and most of those were older men that smoked and drank during the 70s. They were whooping it up, and their immune systems would be compromised anyway. They're older, they're smoking, they're drinking, and so a bunch of them, after this conference was over and they went home, a bunch of those men died. They got sick, and a bunch died from it, and they didn't know what the bacteria was, and that somebody worked on it and came up with this guy. So this organism grows in natural waters, air conditioning, cooling towers, whirlpools, humidifiers, showers, fountains, anything like that. It could be spread. Hospital water lines, and it's resistant to chlorine. And it forms a protective biofilm. And another virulence factor is it can replicate in macrophages and amoebas. My ex-husband came out to, my grandson graduated this last summer, and when he got home, he was staying in a hotel here, and when he got home, he came down with this Legionnaire's disease, and it put him in the hospital for about a week. Pretty serious stuff. Symptoms are a high fever, dry cough, general symptoms of pneumonia. Transmission is airborne, so there's no person-to-person transmission. It's usually in some sort of thing like air conditioning through that you get like maybe in a hotel room. And he also was in a plane, so you have to worry about that as well. But his doctor thought it was probably the hotel room. Diagnosis is culture on selective charcoal yeast media, examination of respiratory secretion. Treatment for this bacteria is also erythromycin, and there are other antibiotics that they use as well. So this is a picture of a macrophage. And the macrophage has pseudopods because its job is to go out and engulf whatever shouldn't be in there and bring it inside of it. So these are the pseudopods, these things here. And here are the bacteria that it took inside, but instead of chewing them up and breaking them down into small pieces and spitting them out, those macrophages are living and growing inside. Those bacteria are living and growing inside that macrophage. Q fever. Pathogen is Coxiella burnetii. It is an obligate intracellular bacterium. That means it's a very small bacteria that has to grow inside of the cell. Karen wouldn't be able to culture this in culture media. The vector that spreads it is the cattle ticks, transmits it among animals. And then the bacteria is shed in feces, in milk, in urine, fetal tissue of infected cattle and sheep. Transmission is by air and food products. And inhalation of a single bacteria is enough to cause infection. So remember, they have infected doses, and with many things you have to take in thousands of organisms before it becomes sick. This one, all you have to do is take in one bacteria. Acute Q fever, the symptoms are a high fever, headaches, muscle aches, coughing, and malaise, tired, you're not feeling good, and that lasts for months. And the heart can become involved. With chronic Q fever, 5 or 10 years after the initial infection, then the patient can develop endocarditis. And this particular disease is endemic, meaning it's around in a certain numbers all the time in California, Arizona, Oregon, and Washington. And can be treated by antibiotics. Fungal diseases that infect the lower respiratory tract. The spores are easily inhaled, and then when you inhale that spore, the spore germinates in the lungs, down in the lungs. And these fungal diseases have been increasing. Some of them, some of the fungi that infect the lungs are Histoplasma capsulatum, Blastomyces dermatitidis, and Coccidioides immitis, which is the one my sister had. The last one. Most of the infections are asymptomatic, and your body will take care of them. You know, they resolve on their own. But sometimes the fungi become systemic, and they spread to secondary sites and cause more serious disease. So we'll talk about these fungi. So each type of these mycosis is restricted to a specific geographic region, and these three fungi are dimorphic. They have two phases. They go through a saprobic stage and a parasitic phase. The saprobic phase, they grow in the soil, and they form hyphae. They can form conidia, which are asexual spores. They can fragment. And the transmission is airborne. The conidia get airborne, and they go into the respiratory tract, and then they trigger that parasitic phase. The parasitic phase can lead to the development of spiracles. The spiracles are, we'll see a picture of one, but they have little spores inside them. They're contained within this sac thing that's called a spiracle. Or they can form yeast-like forms. We looked at one a couple weeks ago. Once it got into the lung, the capsule expanded and had to be a small capsule for you to inhale it and get it down into the alveoli. Coccidiomycosis is also known as valley fever or San Joaquin Valley fever. And the pathogen is Coccidioides immitis, as arthroconidia in the soil, and they grow into these hyphae filaments, and then they can be transmitted by the wind, and you can inhale it, and it can cause infections. And where my sister lives in Arizona, they have these huge dust storms called haboos. Go on the internet and look. It's just, she says you can't even drive when they have them. It's too much dirt flying around in the air. These arthroconidia get inhaled into the bronchioles and the alveoli, and then they develop into these thick-walled spiracles. And inside those spiracles are the spores, endospores. And when those spiracles break down and the endospores come out, then those endospores can go spread to other tissues and form new spiracles. And what happened to my sister, they had to differentiate whether that spiracle was actually the coccidioides, the fungus, or whether it was cancer. And if you go on the internet and look up cancer, you know, the lungs, it'll show you something that looks just exactly like that spherical did. So when they went in to do a biopsy, well, after that, then new sphericals formed around her other spherical. Symptoms are chest pain, fever, chills, a dry cough, sore throat, and in less than 1% of the patients, the disease resembles tuberculosis and goes throughout the body. That's another thing that they had to differentiate prior to them even breaking into the spherical, as they made sure it wasn't tuberculosis. It can produce abscesses throughout the body, which can be life-threatening. It can cause meningitis too, that could kill her as well. So they need to isolate the pathogen so that they can distinguish it from tuberculosis. You don't want to get a fungal disease, you know, because if you get a bacterial infection in your lungs, well, you can treat that with antibiotics. But remember, a fungus is the same cell type that your body is. And chemotherapy they use for that is very hard on your body, and they do liver enzymes tests. Diagnosis is made by identifying the sphericals in the tissues or fluids, and treatment. If the disease progresses, it may cause you to be hospitalized, and you may need to get a lobectomy, and that's what happened to her. She had to have a lobe taken out of her lung.
Also, it's a pig.
The antifungal drug most common is for this is amphotericin B.
Scary.
Used in serious cases. So there's a picture of the spherical. This is it. And inside of it are the little endospores there. If that broke down, each one of those endospores that came out could form a new spherical. Blastomycosis. The pathogen is Blastomyces dermatitis, a dimorphic fungi found in the Mississippi and Ohio valleys. Most of these cases are asymptomatic, but if a patient comes down with symptoms that resembles a bacterial pneumonia, with a persistent cough, chest pain, fever, chills, night sweats, and you're not feeling too well. So inhaling the spores can lead to infection of the lungs and produce bronchopneumonia. It can spread fast and can go to other parts of the body, including the skin, and then you can get cutaneous ulcers on the skin if it's affecting that. There's extensive abscess formation and tissue destruction. You've seen a picture of somebody that had this, I think. And diagnosis is isolation of the fungi from pus and biopsy of the ulcers and exudate. Treatment is amphotericin B. So there's a picture of the actual fungi. You can see the little thread-like things are the hyphae, and then they have the ends are called blastomeres.